Well, good afternoon, everyone, and welcome to our first Fall 2023 MKRC Student-Led Journal Club and Case Study presentation. We're particularly happy to offer a full program for this iteration of the Journal Club and have at least one, and in some cases, two presenters as we have today for each coming Tuesday at noon between now and next June. The schedule is almost full. We invite you to join us for as many of these presentations as you possibly can. I only ask that participants mute their microphones during the presentations, and we'll open the discussion for questions at the end. Today, we have two speakers scheduled, so please stay tuned for both talks. First, our presentation. I'm pleased to introduce student Dr. Joey Peters, who's completing his first year of medical school on the Kansas City campus at KCU. Before he came to KCU, he earned his bachelor's and master's in kinesiology, and get this, a PhD in exercise physiology and biomechanics from the University of Illinois at Urbana-Champaign. It's a great school, man. Where his dissertation research focused on the feasibility of a high-intensity interval training-based hand cycling activity for people with spinal cord injury. While he was earning his PhD, student Dr. Peters applied his knowledge of sports science as a coach for the Team USA Paratrack. Amazing. And at the 2020 Paralympic Games, the athletes he coached won 11 medals, including 5 gold. I'm going to place this link in the chat because student Dr. Peters was a little bit demure and didn't want people necessarily to know about all this, but my goodness, what an accomplishment. So I'm going to toot his horn a little bit. Are you guys seeing that link in the chat? Give me a thumbs up. All right. So today, the title of student Dr. Peters' presentation is The Relationship Between Fear of Falling and Common Symptoms of Multiple Sclerosis, a systematic review. We're so happy to have you join us, student Dr. Peters. Actually, I can call you Dr. Peters. I'll turn the floor over to you.
All right. Can everyone hear me all right? Can you hear me?
Yep, we can hear you.
Okay, perfect. So yeah, I'm Joey. I am a first year medical student at Kansas City University. And yeah, a little bit, Dr. Stoutinger introduced me already, so I won't go too much into that. But I added a video to kind of give everyone an idea of kind of what my dissertation project was in, looking at the effectiveness of a high-intensity interval training program for people with spinal cord injury. I was also a coach for the Paralympic national team, where we did a lot of outreach programs for kids with disabilities, and that's ultimately what led me to wanting to pursue a career in medicine, so I could maybe better help this population. But onto the project for today. So we're going to talk about fear of falling and common symptoms of MS. And the relationship that we found. So we did a systematic review on that. So for MS, so multiple sclerosis is an autoimmune disease that leads to the deterioration of the myelin sheath of the nerve and spinal cord tissue. And so what we'll typically see manifest in people with MS is impaired motor and cognitive skills. So we'll see altered gait, balance, and strength, and then we'll see mood, cognitive declines, and fatigue, increased fatigue as well, due to the demyelination of these neural fibers in our central and peripheral nervous system. Unfortunately, many of these dysfunctions associated with multiple sclerosis put these individuals at high risk for falling. And so with the fall, we're going to potentially see high risk for injuries, healthcare costs, and reduced life expectancy. This has led to several research groups trying to focus on ways to prevent falls by addressing maybe some of these common MS symptoms. However, the research has not been as effective or as impactful as initially thought. So kind of a goal of this systematic review was to maybe try to fill in some gaps and see what we may be missing in our fall prevention interventions for this population. So we want to examine fear of falling. And so fear of falling, typically that may start as protective. That's going to be that fear that you are going to fall, typically which arises after a fall occurs. And many times this starts as protective, but may lead into an anxiety disorder where we are reducing our activities of daily living. We're seeing reduced quality of life. And ultimately, what we're finding is that this loss of confidence and function due to the fear of falling is increasing our fall risk. So if we look over to this diagram, we'll see a fall. We have fear of falling. We have decreased activity. That's going to lead to maybe loss in confidence and function. And then we increase our risk for falling and kind of see this kind of vicious cycle manifesting. Because of this, we believe that fear of falling, because of this loss of confidence and you're reducing your activities, it could also lead to an exacerbation of these MS symptoms like gait dysfunction and balance control because we're not using our bodies as much as we did before. There's also this idea that fear of falling may develop without a fall occurring as well. So if we're having these common MS symptoms, that could be leading to altered gait patterns. And so with that, the participant or the individual with MS may be feeling less confident, and then a fear of falling may arise. And again, once that occurs, we might be bringing our individuals, or these individuals may be entering this cycle again, this vicious cycle of fear of falling, decreased activity, increased risk of falling, and then falling. So previous research has examined the relationship between fear of falling and common MS symptoms, or fear of falling and common MS symptoms and falling. All showing positive relationships between the two. However, no systematic review has examined the relationship, the specific relationship between common MS symptoms and fear of falling. And so our hope is that this will provide insight into and a more holistic approach in improving fall risk in this population. We understand that common MS symptoms may be unavoidable, but we don't want them to be further exacerbated due to fear of falling. So we're hoping that by creating targeted based interventions based on this systematic review, that we can prevent the exacerbation of common MS symptoms and ultimately fall risk. So that was the purpose of this systematic review. We're hoping to also develop a conceptual model of MS symptoms, fear of falling, and falls among persons with spinal cord injury or multiple sclerosis. I've worked too much with spinal cord injury, so I apologize in advance if I keep switching back and forth, but we are just talking about people with multiple sclerosis today. Research in geriatric populations have done similar methodologies, doing a systematic review or doing a review of the literature and developing research or interventions that have addressed fear of falling and some of these common symptoms related to falls, and they have been effective in preventing falls in their geriatric populations. So this is kind of a depiction of what we're hoping to gain from this review. So research has looked at the fear of falling and falls, and research has also looked at common MS symptoms and their positive relationship with falls. So we're hoping with this review to kind of look into how MS symptoms and fear of falling, this arrow should actually probably be going back and forth, how they kind of play a role in one another. So for a methodology, on this project, we followed PRISMA recommendations. And if you're interested in looking into this review protocol further, it has been registered on Prospero. That's the number. It's going to be too long for me to read out, but feel free to take a screenshot so you can look that up at your own leisure. Research or publications, peer-reviewed publications were included in this review that were published before June of 2023. That's when we ended our screening, or when we ended our that initial part of the screening process. And we used keywords such as multiple sclerosis, fear of falling, concerns about falling, gait, postural balance, fatigue, pain, cognition, depression, and anxiety to help retrieve articles. We only included articles that included adults with MS over the age of 18, and then had outcome measures of fear of falling, neuromuscular function, fatigue, cognition, pain, mood, and sleep. We extracted information related to our study characteristics, our study participant characteristics, and then those outcome measures of interest, the fear of falling, common MS symptoms, and the association between the two. We also reviewed each included study and assessed its quality using the standard quality assessment criteria for quantitative studies. This was to ensure that the studies were of low bias and of good quality. So for our first initial identification, we started with about 252 articles. And after reviewing and screening, we ended up with 22 in our review. So in total, we had over 2,500 participants or people with MS that participated in the included studies. Mean age was 30 to 57 years. The population was had a higher percentage of females. That's something that we'll typically see in the population with multiple sclerosis. And expanded disability status scale, otherwise known as EDSS, from the studies ranged from 0 to 6.5. So EDSS, expanded disability status scale, that's a common method of quantifying disability in people with MS. And the higher that we go on that scale, the greater disability or severity of disability. Disease duration was 4 to 15 years, and relapsing remitting MS was the most common type of multiple sclerosis among the participants in the studies. Studies reported on correlations between fear of falling and MS symptoms, and then their predictive nature on one another. So onto our results. Our results show that fear of falling was correlated with poor gait performance, and that fear of falling predicted worse gait control. Fear of falling was also associated with reduced performance in mobility, balance, strength, and functional walking. However, these common MS symptoms were predictive of fear of falling. So we're seeing kind of this bidirectional predictive phenomenon occurring in these two variables. So fear of falling predicted worse gait control, and then these common MS symptoms in these studies were found to predict fear of falling. We found that fear of falling was associated with postural control, or increased fear of falling was associated with reduced postural control, and that fear of falling in this instance was predictive of poor postural control. Fear of falling was associated with reduced executive function and lower global cognition. But in these studies, or in the studies that looked at the predictive nature of the two, they found that higher cognitive function was predictive of reduced fear of falling. Fear of falling was associated with fatigue and then also sleep quality deficits. For a quality assessment, all studies that were included in this review were presented with strong or good to strong methodological quality, appropriate sample size, using sufficient powers, using like power analysis or being sufficiently powered. That was our most common deficiency that we found within the included studies. So to kind of discuss our results supported a positive relationship between fear of falling and common MS symptoms. We looked at this finding and related it to self-efficacy, which is the belief that one can safely and effectively complete a task. We believe that the decreased self-efficacy as a product of reduced physical function may have led to activity avoidance, which may have initiated that vicious cycle between fear of falling, common MS symptoms, and falls. The correlation found between fear of falling and common MS symptoms may also explain the phenomenon that fear of falling can develop in the absence of a fall as well. We found that the predictive relationship between fear of falling and common MS symptoms is bidirectional. So on one hand, fear of falling predicted gait performance, while on the other hand, function and cognition predicted fear of falling. Excuse me. So we believe that participants may have compromised their gait to avoid falls, which is a common mechanism employed by clinical populations to avoid falls and may explain the predictive nature of fear of falling on gait and postural control. Common MS symptoms such as function and cognition may relate to the neural pathway changes associated with MS. As I brought up earlier, with people with multiple sclerosis, we're seeing that demyelination of their nerve fibers. So we're having difficulties sending those brain communications and body communications back and forth. These changes in the neural pathways may lead to the reduction in one's processing capacity, which which research shows may increase their fall risk, leading to that subsequent development of a fear of falling. This finding also supports that idea that MS symptoms may lead to the onset of fear of falling without the occurrence of a fall. But in terms of understanding this, how neural pathway changes affect one's fear of falling, fall risk, and common MS symptoms, more research is needed. So through this review, we believe that there is a dynamic interplay between fear of falling and common symptoms of MS, and that these ideas or incorporating fear of falling interventions into a more holistic fall prevention program is needed. We suggest incorporating home-based interventions, cognitive-based therapies, and physical training into the fall prevention programs that are also addressing common MS symptoms to ultimately reduce this population's risk of falling. So back to that depiction that I had brought up in the beginning of this talk. This was our initial kind of outlook of this project and what we were hoping to add to the literature, kind of this kind of cyclic triangle depiction of common MS symptoms, fear of falling, and their relationships with falls and injurious falls. However, after this review, we believe that that depiction should look more like this figure here, where we see this interplay between common MS symptoms and fear of falling. We also see how common MS symptoms can increase fear of falling, and how all this ultimately will lead to that overall increased risk of falling and kind of the negative consequences associated with that. and then also how the various reviews that have been published thus far kind of talk about some of these relationships as well. Some limitations in this review the studies that were incorporated or were included in this review were done by many of the same research groups outside of the US. So trying to find ways to bring some of this research to America, to some of our, high quality universities. That's one of the goals of this project. So we can, I guess, correct this limitation. No studies examine anxiety, depression, and pain. And in other clinical populations, we've seen meaningful relationships between them and fear of falling. And then many of the studies that were included in this review only examined ambulatory people with MS. Fall prevention strategies and research also needs to start looking at non-ambulatory people with MS, those that use wheelchairs and assisted devices in the overall development of fall prevention programs. That's kind of the idea of this future project that we're hoping to develop in creating a multi-dimensional fall prevention program for this population. So that's my project, or that's my talk. If you have any questions, feel free to ask now or send me an email. And yeah, thanks for listening.
Thank you, Student Dr. Peters, for sharing this presentation. Participants, you can now unmute and raise your hands. Dr. J, I see you had your hand up. Go ahead.
I do. Student Dr. Peters, I will compliment you from the get-go. This is very professional, very well organized, and you're very knowledgeable in the areas of appears to be kinesiology and some neurology. So I hope someday you'll find the cure as a neurologist or a scientist or something for this nasty disorder of MS. I've got a couple questions, and then first of all, I'll start out with your observation of this. When you look at this, and you've studied this for a while, has there been anything that surprised you, that came out of it that you didn't anticipate, and you could say back, I didn't see that coming? Anything that you learned from this process?
Yeah, I think that bi-directional predictive relationship that we saw, I thought that we would maybe see it being more, I guess, unidirectional, where either fear of falling or common MS symptoms predicted each other, but kind of that back and forth where we saw in some areas fear of falling predicted the common MS symptoms, and then the other aspect where common MS symptoms predicted that fear of falling. I think that was the most meaningful or the most surprising thing that we found. Yeah.
Well, you inferred, I think, I know to me that's not a big surprise. And I only say that based upon the art of medicine. When you practice it, you're going to find out that certain things can beget certain things. And I say that based upon, you alluded to the fact of some cognitive skills. The more cognitive skills I think you can retain, the more common sense you can apply to the potential of a fall. Versus if you didn't have the cognitive skills to put it all together, you would certainly be at higher risk for a fall. So to me, that's not a big surprise. But on the other side of the coin, I do think that you put this together so well that you can follow this forever. And the hardest part of this, the hardest part is going to be to adapt something, particularly in a home care setting or in an ambulatory outpatient setting, where you can teach these folks how to manage this. The sad part about this And you know more about this than I do, because I haven't reviewed MS in a while. But I don't know that there's anything right now that's slowing the progression of the demyelinization of myelin, I should say, in the progression of this disease. Are you aware of anything else that's new out there?
No, no. I'm not aware of anything that is that can prevent that. But that was kind of our idea with this, was that, some of those common symptoms of MS are unavoidable, and their manifestation is going to occur kind of no matter what. But we don't want to further exacerbate that with kind of the similar presentation of fear of falling, and how some of those issues can arise that present similarly, like those gait patterns. Like we talked about. We don't want to further exacerbate the already kind of impending doom.
Yeah, no, I understand.
It's tough, and
that's where the PM&R comes in so much, and plus, the heightened risk of trying to prevent that fall is just is paramount, because we all know the catastrophes and the morbidity associated with the fall. So I want to say thank you. You started this season off with outstanding presentation, and I wish you the very best in pursuing this topic. Thank you.
I would echo that and say to you, it's just such a beautiful thing to see you rolling your PhD into your desire to become a practicing clinician in a similar field. So appreciate that about you, Dr. Peters. Dr. Wolf, go ahead.
Yeah, thanks. I was curious. I wanted to follow up a little bit more with your discussion related to balance, like contrasting the elderly versus MS patients. It seems to me that elderly, like my father being an example, gets around just fine with his walker. But if you've got balance problems, it seems to me that I don't need to fall in order to know that I'm at risk of falling. And if I were to try to walk, that I would have heightened risk. So I was curious how important balance showed up in your review here. And then the other thing that was curious to me as I pondered on this was, does anybody, I know my father's got the wheeling walker with the brakes, hand brakes and stuff like that he uses all the time. But when we were with babies, you got the little stroller where you put, a piece of cloth through their legs so that they can't fall. And I'm curious if anybody has made something like that for adults who know they're at risk of falling, and that might be a means of preserving their ability to walk. It provides them some stability in all directions should they actually lose their balance.
If I can jump in real fast, tagging on to your question and comments, Dr. Wolf. Dr. Peters, that was one of my first questions that Dr. Wolf kind of pointed out there a little bit. I have seen these apparatuses where the patient puts it on, and if they fall, it's like an airbag in a car. It encloses them and things like this. Is that something that's really there, or is this something that some con artist is selling and stuff like that? And I apologize for the interruption too.
Oh, you're fine. Yeah. In terms of assistive technology, my background was mainly with wheelchair users and the development of wheelchairs, where we actually was working on a project before medical school where we were developing an autonomous wheelchair bot that had anti-tip function. So if you felt you were going to tip, it would auto correct you. The issue with a lot of these devices, from my understanding, is, we want to integrate this population into like the world. We want disability to be out there and public. And when we have these huge assistive devices, unfortunately, I feel like it takes away from the individual and makes it more about their disability, if that makes sense. And so, yeah, like you could have this device, this almost bubble device that is extremely, I don't know what the right word, but very, I think the word like ostentatious, very like loud and everyone can see it. And it kind of, these individuals with disabilities, while they may need a device to participate in the community, they don't want it to overpower them. And so many times by having those big devices that prevent costs or falls at all costs, it ends up doing the opposite. And then we're seeing that huge, that huge abandonment rate in assistive technology. And then it's almost like, we're wasting money and resources on these ideas. So that's kind of what I've been kind of seeing in this, working in this world for a couple years. Did I answer that question?
Indeed, you did. Listen, in the interest of time and consideration for student Dr. DeMarcus, I would ask you to hold your questions, email student Dr. Peters if you wish to continue this conversation.